going to do here this morning is do a posture primer here with Miss Emily, who is a fairly novice posture student. So what we'll start doing, I'll have you turn towards me. We have shoes off, and we're going to start with feet about hip width apart. And so feet should be nice and square and straight. A lot of times we're not even aware our feet are turning out, in or out. I'll have you start out, Emily, by just rolling your weight onto the outer part of your foot and then onto the inner part of your foot. Paying close attention to the big toe and little toe knuckles, okay? So the ball of the big toe and ball of the little toe. Finding that even position between the two is really our goal. So I'm going to have you just lift a little bit more on this right foot. So keeping your big toe knuckle down, just lift your arch just a hair. So from the foot, the grounding 3 points, if we think of a tripod, it's actually the center of the heel bone, the big toe knuckle, and then the little toe knuckle. So we call this a tripod. Then I'll have you shift your weight forwards and back over the ball of the foot and heel and try to find an even position there as well. So really important in standing that we start out by grounding ourselves well from the floor up. All right, so when you feel like you're even there, you can stop. Good. Knees are nice and soft, which is great. So the next point is stacking our blocks, our rib cage and pelvis, so we can consider them as blocks, and then after that our head over the top of this. And the goal is really to minimize stress and strain on ligaments and joints, but also to activate our own current given core strength. Okay, so I'll have you start out by putting your hand on your rib cage and on the front of your pelvis, and then just try to stack them in this vertical plane. So you may feel like you have to actually lean forwards a little bit from your rib cage, yep, and then look down so that you can make sure that the hand is right over, top hand is right over that bottom hand. Great, all right, and then just bring head right back up. So with that, the cue that I often give is rib cage forwards, tailbone tucked. And so the tailbone tucked here basically reduces that arch or that sway back that we sometimes get at our low back. And so again, just activating our own core muscles, okay? The last thing I have folks do in standing is think about what their head and neck are doing and shoulder girdle. So we want the ear directly over the shoulder. And so the medical term for this hole is basically external auditory meatus. We want that position directly over the shoulder. So to do that, Emily, I'll just have you slide your chin back a little bit, like you're making a double chin, as if someone's pulling you up from a ponytail at the low back nape of your neck. And that really optimizes the space at the neck. So you can see how her ear moved back slightly more over her shoulder. The last thing is shoulder posture. So gone are the days where we say, okay, pinch the shoulder blades back and down for good shoulder posture. What I'll have you do, Emily, is just take and shrug your shoulders up to your ears, turn the palms forwards, and then just settle the shoulders back down. So it should feel like it opens up across the front of the chest a little bit. We get out of that slouch posture. A lot of times we say, okay, lean your ribcage forwards, and the shoulder blades go with it. We don't want that. We want you to stay nice and open so that the shoulders have a maximum amount of space as well. So that if I push down on her and exaggerate what gravity is doing, essentially she should feel pretty solid through the floor. I may, with you, Emily, have you actually do a little bit more of an exaggerated forward trunk lean and an exaggerated tailbone tuck down, and shift your weight forwards just a hair more. Okay, so really ground through those big toe knuckles in the center of the heels, and for you, I think that'll give you a little bit more solid posture. Okay, so that's standing posture. Thank you.